Hi, this is my patient Amy. She's a 21-year-old well-developed, well-nourished female and no apparent distress. Amy presents today for a comprehensive physical exam. So we're gonna Hi Amy, how are you?
Hi.
My name is Linda. I'll be your nurse today. We're gonna do a physical health examination. Is that okay?
Yeah.
Can you verify with me your name and birthday, please?
I'm Amy B, and my birthday is April 24th, 2000.
Perfect. I'm just going to check your wristband, and then I will pull the curtain for privacy, wash my hands. At this time, Amy does not have a chief complaint or reports of any pain or discomfort, but if she was, I would ensure that I would use old card system of history taking. Amy, do you have any questions before we start the physical exam?
Nope.
Nope. Perfect. We'll get that started. Okay, Amy, so we're gonna start with assessing your head, face, and throat. So to begin this, we'll be palpating your head, making sure it's normal, cephalic, and atraumatic. Your scalp has no lesions, bumps, or signs of infestations. Your hair is evenly distributed, long and thick. And then we will go to palpating your temporal artery, making sure there's no hardness. And then your TMJ, can you please open, close, clench your jaw. While we're here, we are going to palpate your sinuses. So we have your maxillary and your frontal, and then your salivary glands, your parotid, submandibular, and sublingual. After that, you will palpate your lymph nodes. We have the preauricular, postauricular, occipital, submandibular, jugulo-digastric, submental, superficial, deep cervical chain, posterior cervical chain, and supraclavicular. I'm going to palpate for your carotid pulse. It is 2+, so that's good. While we're here, we're going to look at your neck. It is midline. There's no tracheal deviation. While we're here, we're going to assess your range of motion. So can you please put your chin to your chest and all the way back, and then the left and right. So my patient has full range of motion. She doesn't have any complaints of pain. So overall, your skin and head and throat looks good. They're intact. There's no lesions, and yeah. Okay, Amy, so now we're going to assess your skin. We're going to look at the texture and pigmentation of your skin. I'm going to check your temperature with the back of my hands. They are warm, and we will palpate for your radial pulse, 2+, brachial pulse, 2+, which is normal. So we're going to check for capillary refill. It is less than 3 seconds, so that's good. There's no clubbing, no cyanosis, no edema, and that's good. And since we're here, we're going to check your range of motion. So can you please flex and extend out your wrist, point your fingers out, spread them, close them. Range of motion is good, and my patient presents no pain at all, so that is good. Okay, Amy, so we are going to assess your ears now. By looking at it, I can see that they are equal sized bilaterally, no lesions, they are intact. And then we will assess your cranial nerve 8 by doing a whisper test. So I'm going to whisper something in your ear, and you're going to repeat it back to me, okay?
Okay. White socks. Thursday.
Okay, perfect. So your cranial nerve 8 is intact. Everything looks good. Okay, Amy, so now we're going to assess your eyes. Your conjunctiva looks clear. There's no discharge. Your sclerae are white. We are going to assess your EOMs at this point, and at the same time, we'll be assessing your cranial nerves 3, 4, and 6. What I'm going to do first is the diagnostic test. What I want you to do is follow my finger, okay? Perfect. And then we're going to do the cover test. So if you could cover your eye, I'll cover my left. And then you'll just tell me when you see my finger in your peripheral, okay?
No.
Okay, and then we're going to switch. No. Okay. And then we are just going to test your corneal light reflex. So if you can just look straight ahead and perfect. And then we are going to do the accommodations test. So if you can just stare straight at my face, okay? Perfect. And so for these assessments, your cranial nerves 3, 4, and 6 are all intact, which means your pupils are equal, round, reactive to light, and accommodation. And then after that, we are going to assess your nose, mouth, and throat. But for the because of COVID, we aren't doing that. But if I was to assess that, I would tell my patient to breathe through her nares and inspect her turbinates. There are no abnormalities in her throat area. I would check her buccal mucosa, throat, and uvula is midline. There's no debris or decay. Okay, Amy, so now we are going to do an examination of your chest, but because of privacy reasons, we will be keeping our garments on, but I will be inspecting from the anterior and posterior. So we will start with the posterior side. So Amy, if you could please turn around for your back. I will just be inspecting her posterior back, making sure there's no bumps, lumps, or lesions. And then I will check for chest expansion. So Amy, if you can breathe deep, I will put my hands here and measure chest expansion. And it is symmetric with the chest expansion. And then now I will go on to tactile fremitus. I will be using the ball of my hand. If you can say 9 every time I put my hand on your back, okay?
9, 9, 9.
And I'll be going down in a ladder-like movement.
9, 9, 9, 9.
And vibrations are symmetrical bilaterally, so that sounds good. After that, I will be percussing, and we will be doing that in the same way. And there is resonance with all of her lung fields, so that is good. After that, I will be checking for CVA tenderness. So let me know if you feel any pain.
Nope.
All right, and so after that, I will be auscultating for any lung sounds. I expect to hear bronchovesicular and vesicular sounds and no adventitious lung sounds. So Amy, if you can please breathe for me. And the lung sounds are good. Perfect. And we are going to move to the anterior part of your chest. So Amy, if you can please turn around. We're going to do the same thing anteriorly. So I will inspect her chest while for any bumps, lesions, or masses. And then I will assess for chest expansion. So if you can breathe deep for me, please. And they are symmetrical, and I will do tactile fremitus again. So if you can say 99.
9, 9, 9, 9, 9, 9, 9, 9.
All right, and vibrations are symmetrical bilaterally. And now I will percuss for resonance. And they are all resonant. Then I will auscultate for bronchial sounds, bronchovesicular, and vesicular. and lung sounds are normal, no adventitious sounds. And then while we are here, we'll be assessing your heart. So if you can please lay down for me. I will first be inspecting the precordium, and then I will palpate for the PMI located at the fifth intercostal space, a midclavicular line, right here. And then I will auscultate, starting at the apex of the heart, working my way up. Alright, and then I will ask my patient to turn onto their left so that I can listen to any possible murmurs associated with mitral stenosis. Okay, and then while they are laying here, Amy, you can lay back on your back. We won't be doing a breast exam for privacy purposes, but I will educate my patient on monthly breast exams. So every month you will examine your breasts during your period when they are most tender and smallest. You will use your 3 fingers to palpate your breast area for any lumps or bumps. You can put your arm over your head and palpate your underarm area for any lumps or bumps, and that is every month, okay? Okay, Amy, so now we are going to be examining your abdomen. So still for the purpose of privacy, we are keeping her garments on, but I'm going to be assessing the contour of her abdomen, that it's symmetrical and non-distended. I will then auscultate all 4 quadrants. I will start with the right upper quadrant. And I am noting that there are vowel sounds in all 4 quadrants. And then I'm going to take the bell and I'm going to auscultate for the aortic and renal artery. Perfect. And then I am going to do, I'm going to palpate for liver enlargement using the hook technique. I'm supposed to be standing over her, but because there's a couch there, we are going to pretend that I can. But Amy, I'm going to ask you to breathe in deep and hold it, and then I would use the hook technique, and I would be able to feel her liver if there was liver enlargement. So that's for deep palpation, and then for palpating the spleen, we're going to palpate normally, pushing up and palpating. The spleen is normally not palpable, so I wouldn't have any findings. And then we will percuss each quadrant for tympany. It is tympanic, so that is normal. And then we will go down to palpate inguinal nodes, but because of privacy, we are not doing that. But if we were to do that, I will palpate towards the femoral artery. And since you are already laying down, we are going to palpate for your popliteal artery, your dorsalis pedis artery, and then your posterior tibial artery here. No abnormalities. And then we are going to work on our range of motion. So if you can lift one leg up straight and the other, Then we're going to do the same for the knee to chest. And then we are going to check for range of motion in her ankles. Dorsiflexion and flexion. Perfect. And now I'm going to have you sit up so we can test your range of motion for your upper extremities. We did the wrist and fingers earlier, so now we're going to test the range of motion and strength for our arms. So if you can push up against my arms, please. Same for downwards. And then pull my arms. And then now we're going to test range of motion for her shoulders. So if you can up, down, extension and flexion, twist side to side, and the range of motion is good, and strength is 5 out of 5. Okay, Amy, so now we're going to do an examination for your neurological assessment. So to do that, we are first going to assess your cerebellar function. So what we're going to do is the nose to finger test. You're going to have your finger at your nose, and then you're going to point towards my finger and back to your nose and every time, okay? Perfect. That looks good. Totally. Sharp. Sharp. Dull. Perfect. To ask you to stand, please. Now I'm going to ask you to walk across the room. That's good. I'm going to note that Amy's gait is steady, and if you can walk back in a heel-to-toe fashion, please. Perfect. Now we're going to do the Romberg test. Amy, so if you can have your arms by your side, feet together, you're going to close your eyes. This will be for 20 seconds, and you can open them now. We're just going to have you lift one foot up and have a slight knee bend for each leg. Perfect, and that is good. Amy has a good position sense, muscle strength, and cerebellar function. And so now we are going to have Amy stand up while I assess your spine. I'm going to have you bend forward. I'm just going to assess the spine for any curvatures. There is no scoliosis, no deformities, no abnormal curvatures. All right, perfect. Thank you, Amy. So now the physical examination is done. I would just go over these physical findings with Amy and tell her that there are no abnormalities. And Amy, do you have any other questions before we end? No? Thank you. Thank you.